Thank you, Sandeep ji, and thank you, Hindi team. हमारा participants का number ज़्यादा हो जाएगा. हम IFPH शुरू होने के वक्त में less than 6 members था. अभी हम ज़्यादा बहुत language में आया. अभी तमिल भी शुरू होने वाला है. इसलिए अभी कोई क्या बोलते हैं, less, don't think less, because we will increase the number of our participants. Thank you so much. Even though your involvement, सब कोशिश करते हैं. अभी भी हमारा ये हिंदी सेशन अच्छी तरह से चलते हैं. I'm so grateful to all of you. Thank you so much. Now it is the time for the English session. Thank you so much, and welcome and good evening all the participants to our English session. Thank you so much. Today is our 1028th day. One more page in the history of IFPH. Thank you so much. We will start with the silent prayer. Welcome and thank you all the participants. Continuously we are conducting this uninterrupted webinar for last 1028 days. So we are continuing our journey. I'm so grateful to all of you for your participation and support to IFPH and your love to IFPH. Thank you so much. And today's our guest is Dr. Paul Joseph. He is practicing in Toronto, Canada. And he is a BHMS graduate and have postgraduate diploma in acupuncture. And he was the former professor of College of Tamil Nadu, Homeo College in Tamil Nadu under MGM Medical University, and author and writer of various medical articles and published Tamil books on health and health poems. He published many health poems. He was a radio host doing talk show on health and politics in Geetavani, doing talk show on health in TET TV for 10 years in Canada. And today's subject is known remedy, unknown truth. Beautiful subject. Dr. Paul Joseph, he has joined. Sir, welcome, please. Dr. Manoj, can you? Oh, I'm so sorry. Dr. Manoj, Dr. Sridhara Kuru, can you do one favor for me?
You ask the technical people, they may do, but now today is our Baburajan is there. You request him, he will do it.
Okay. Dr. Baburaj, please make Dr. Paul Joseph as a co-host. Otherwise, Dr. Manoj, are you there? Actually, Sandeep made Dr. Manoj as a host, so I cannot do anything here. Anyone from technical side, please make Dr. Paul Joseph as a co-host. Dr. Paul Joseph?
Yeah, I'm here, but the video, I can't make my video here.
Please tell how to make, I don't know. That is why I told that to ask the request.
Okay. Let me call someone, because.
That you tell that I shall try what to do for making co-host. I can learn also that.
Wait, doctor, Doctor, can you, what about your video? If you can start talking, we will make.
Dr. you talk, then in between she can call the technical people and they can arrange. You start your talk. Okay, no problem.
Okay, Manoj doctor has joined.
Okay.
Okay.
Audible?
Yes, audible.
You see my
You can start.
video? That's my video.
Yeah, yes, sir. Oh, again it stopped, doctor.
Oh, it's okay, right?
Yeah, now it's okay.
Screen share?
Okay, you can share your screen. Yeah, it started.
Okay. Good morning, good evening, good afternoon, everywhere. The people join. Really, it's amazing things all over the world. People are joining and learning homeopathy. This is the 1028 days of seminar. I thank you all administrators and organizers to invite me to deliver my experience in the platform of homeopathy. Today I'm going to talk about the emotional surgeon. One of you unmute and give some opinion what remedy I am going to talk.
Quite natural, Ignatia, Stabisagria, Porticum, so many words are there.
Yeah, you are little close to that. Okay.
Even Natramore also can come.
So in my ideology is little different. Right, to encourage the people to attend and know the things. As the moderator says, known remedy, unknown truth. So today I'm going to, this is the second slide. Okay. Dr. Kent in his Materia Medica, he said the person becomes speechless from suppressed indignation, anger with indignations, complaint brought on by these causes, lasting many days after suppressed wrath. That means the suppressed anger. After insult, the great indignation about things done by others, by himself, griefs about consequences. So that is the James Caylor Kent described in his Materia Medica about this particular remedy. So here, case one, I'm going to present the case. I'm not going to present the case in the PowerPoint, but I'm going to explain the case with the case sheet, from the case sheet. So when is it possible to, for a while, Manoj, it's possible to, for a while, to stop the recording during my expression of care. That's while expressing the case. Is it okay? Is possible or not?
I think it is already recording, sir. There is no problem.
No, I'm asking to pause the recording.
Pause the recording.
Yeah, for a few minutes when I explain the case. Is it okay or if it's not
I
possible?
don't know how it will
Don't tell the name and address, then it is all right. No one cannot see anything.
No. That's a different issue. I'm going to deal with that. That's why. Okay, no problem. Anyhow, don't publish in the medias and all. That's okay.
Yes,
The case one.
They will upload only after editing, sir. No problem. Okay.
Okay. The case one. This is a very interesting and very cruel case. Lady married at the age of 27, The lady has a good family background. She has good job, reputed family. She is from the reputed family. She is little or not little, the more familiar in our community here in Canada, having a good relationship with their friends and family. They have a big family tree, right? A lot of relations. When they get together in a family function, I think more than 500, 600 people they get together. That kind of very close family relationship they have. So she came for the certain complaint. It's a very simple complaint. Pain and numbness in the both hand, especially in the just below the hand, just below the wrist. Sometimes it's radiating from neck. And also she diagnosed as a migraine, non-migraine case. So she is taking medication for migraine more than 2-3 years. So she was on the allopathic treatment. Then the pain and numbness. For the pain and numbness, they did all the parameters, the test, nothing revealed. So finally, the neurosurgeon, they said it could be a carpal tunnel syndrome. So they plan to do the surgery in both hands. And at the same time, she is taking medication for migraine. So in between, through some sources, she came to me. Then I took the history. So there's a turning point in the history. After marriage, there was a conversation between husband and wife. The husband said, "Your vaginal orifice is too big." Why it's like that? So after maybe few months of the marriage, then she said, from childhood, it is like that. Then after a few weeks, again he said, in your office, that is in Canada, in your office, there are a lot of people working, especially black people. So do you know the meaning what I am saying, right? I can't reveal all the things. Then after a few weeks, the same thing was happened. She got angry and the husband consoled her. At the time, they become calm and she become calm, and that's smoothly their lifestyle is going on. Then after a few months, she got pregnant. In the 3rd month, the miscarriage happened. The husband says, miscarriage because of you have contact with someone, right? Maybe she used to work in the office with a lot of male black people, and more at nighttime, night duty. So this was happened. So within 2 years, the marriage, the rock of marriage started breaking and cracked, right? Little bigger and bigger. They finally plan to divorce. So she doesn't share anything with the parents and other family members, but the husband, he shared with everything in his relative. But they were living together, not having any before the divorce. They're living many months not having any physical or verbal communications. Then 5 years later, right, during these 5 years, no such a contact and all. So 5 years later, they got the divorced. So she came to parents' house. Then in between the COVID came and the work from home started. So this is the story. So after that, she shut down all the, because she started working from home, she shut down all the relationship with their relative. She doesn't attend any party or any family function or community function. She isolated himself, right? And also her mother was my patient. So after that, she brought her. So I took the history and I prescribed slowly. She was improved. Her behavior was changed after my medications, right? She started mingle with the, associated with the community. Then the more physical symptoms also improved. So after my medication, maybe 3 or 4 months of treatment, then I advised her to do little Ayurvedic massage to relax her body, because everything is stiff, very stiff, and right, that's kind of all muscles, it's become stiff and all. So I said, go to the Ayurvedic massage and do some yoga too. So she learned yoga for many months. And now she is working as an accountant as well. And she is teaching yoga in the weekend. She become a teacher. She is doing a volunteer job. So I think most of you know the remedy which I prescribed, because everyone knows that, right? So here, the mental symptoms are very important, right? And impressions made upon the mind. And then upon the body. So here, all the sort of insult, humiliations, hatred, and suppression of the everything, including sexual things, right? Then the patient is become a picture of staph aureus. So the whole eye repertories and all these things and everything, you know the story, right? So it's a typical 100% case of staph aureus, right? Then the other way, here I put the journey of causation of staph aureus. That is very important. How the staph aureus patients from childhood, the journey comes and evolve and evolutions happen, and it become the full-fledged staph aureus patients. So staph aureus can have many fears, and fear of being insulted, fear of being mortified, the fear of being killed, and injustice, ego, insult feeling, mortification, suppressed anger, all these stories. So here, in case 2, again, I'll express another interesting case. This is also a very interesting case, but very confidential. And while editing, better to edit the case. The case number 2, it's a case of ulcerative colitis. A female patient came to me. Already they diagnosed through various, because in Canada, all the various cases, various way they diagnosed. Finally, they came with the report and everything. It is a severe ulcerative colitis. And also recurrent, the same case of staph aureus, I'm going to tell that. recurrent styes in eyelids. So it's treated by another homeopath and naturopathy. Here, the naturopath people, the qualified naturopathy doctor, they can practice homeopathy because homeopathy is the one of the subject for them. So she treated by naturopath. They prescribe some homeopathic medicine. So for a while it's improved, then the symptom relapsed. So she came to me, it's about 3 years ago. So I took the history. So there is a very tragedy history behind her, right? I think many of you know or don't know what happened in Sri Lanka in 1989. At the time, she was studying in high school in Sri Lanka, Jaffna area. You know Jaffna, we call it Jalpanam, Jaffna area. So that time, 89, right? Remember the 89 to 87 to 91, not 81 to 8, sorry, 87, 88 to 90.
Yes.
For 3 years,
IFPH.
the Indian army was there.
Yes.
I think all of you remember that.
Yes.
So in that time, the Indian army people, in the name of IPKF, you know IPKF, Indian Peacekeeping Force, went into their village and arrested her, not only her, a lot of young girls, and took them to their camp, right? In the suspicion of if they may be LTT or like that. So this was a routine things happen in Sri Lanka regularly during the period of that 88 to 90. Then after 90, VP Singh came and the Karunanidhi came into the political, then in the power, then the Indian army, they withdraw the Indian army, you know the story. So that time still we have a record, the thousands of women, before it was happened with the Sri Lankan army. Then after Indian army came, the thousands of women were raped and sexually assaulted and abused. So she is one among them. She was released after a few days. Then she migrated to India with a family, right? Then she got admission because she completed high school over there, and she got admission in the college in Tamil Nadu. So she completed her degree in commerce. Then after that, when she was in India, she developed a huge breast tumor. She didn't mention any name or something or any diagnosis because she doesn't have any report with that. She said it's a non-malignant tumor, non-cancerous tumor, doctor said. For the safety, because it's a huge tumor. So for safety issues, they removed. So partial mastectomy has happened in the age of 25, if you believe or not. So at the age of 28, she had a goiter, hyperthyroidism, goiter and all. They become the thyroid gland is become swollen and it become goiter. They removed partial thyroidectomy they did. So this is the history. And after that, at the age of 30, she got married, a person who is a relative living in Canada. But the boy, she knows all the story of her, right, about her. Then after that, they got the migrations things, and she migrated to Canada, having 2 children. At the age of 45, she had a multiple huge fibroid in the uterus. Then they removed the uterus here in Canada, hysterectomy done. Then after that, she developed ulcerative colitis, right? All the symptoms and all. So after the history, totality revealed, right? All the symptoms, the remedy came, the Staphysagria. But constitution-wise, typically it's a constitution-wise, she is a phosphorus. So I prescribed Staphysagria 50 ml potency for a few weeks continuously. Then in between, when she stopped the Staphysagria, I prescribed few doses of phosphorus too. So slowly she started, after a few months, slowly she started withdrawing the allopathic drug. They prescribe aminosalicylate and corticosteroids, prednisone, and other immunosuppressive injection too. So slowly, after 3 months, slowly she improved. Then I advised her diet and certain diet you have to avoid. Take especially dairy product, but except dairy product, but except the yogurt, yogurt, Thai yogurt. So I advise to take more yogurt because it's contains probiotic bacteria. Then I ask him to avoid all the bakery food and junk food and fatty food, be a vegetarian. So she, after that, almost after 5-6 months, completely the case was resolved. Then she stopped all the medications, but still she is coming and prescribing the placebo. So now she is under the placebo. The story is like that. You know, right? So how these people are suffered a lot, right? Because of the insult. So here, expression of anger. These two cases, in different way, they suppress and express their emotions. Expression of anger, it become violent. The other way, suppression of anger, it become non-violent. So this was happening in Gandhi. Gandhi also, many of you know, Gandhi also Staphysagria, right? Typically, that right, the situation of Mahatma Gandhi in case of libertinism, insult due to injustice. So I said Staphysagria is one of the reputed remedy for help Indian independence. We have to salute Staphysagria to all the time. So he, the story of Gandhi. What happened in? So he went to London and he studied law, become a lawyer. So after that, he went to South Africa. So that time he felt when he was entered into the the white people compartment in the train. So he was pushed out by the white people. That moment, that insult, that injustice make the Gandhi in different picture. So that is the point the Staphysagria came. So the Staphysagria, burst out, and Gandhi has become a great soul and the father of nation. So this was happened. You know the other side of the Gandhi. I don't want to reveal the things at all, right? Okay. So Staphysagria, now we'll come to the picture, little picture of Staphysagria, right? It belongs to Radiculaceae family, right? And okay. All the things see here, mortification, vexation, indignation, insult. These are the main, the picture of Staphysagria. But the sharp stabbing, stitching, and stinging, what is that? Here the sensation all the time the Staphysagria patient they feel, not only in physically, mentally also. Mentally also, they felt the same sensation. Right? In Kent, he described in such a way, and even the pioneers of homeopathy, they mention in such a way that what kind of sensation, if they feel the wood kind of sensation, then the expression of the wood kind of sensation is expressed in different way, maybe a tumor, maybe the cancer, or maybe in different way, right? So that pain also is like stabbing, because the patient, she felt in that way, the stabbing by others. Stabbing by means not by knife or something, right? Stabbing by verbally, stabbing by physically, stabbing by mentally. The words that injured, that hurt her. So that's all. Even stabisacria in the other way, the physically, you know, the stabbing injury, surgical injury, cut injury, right? Stabisacria will help in such a way. So you have to compare the physical symptom and mental symptom, right? In such a way, it's almost physical sensation, mental sensation. Always it's comparable. Always it's right correlated. So here, both the patients which I described, ailments from indignation, ailments from suppressed anger, rudeness, great indignation, insult, mental injury as well as physical injury. The second case, right, sexual abuse, right, suppressed emotions, non-healing wound physically and mentally, because the both patients, right, inside the non-healing, right, wound is there. So this is the best. That's why I mentioned the surgeon. Stabisacria is surgeons, right? My mental surgeon, right? Emotional surgeon, to remove the hurt inside, to remove the unhealing wound inside. So in such a way, right? So it can create tumors, it can create ulcer. Maybe the stabisacria basically is a psychotic remedy, so it can express as a syphilitic manifestation, at the same time the psychotic manifestation. So here the stabisacria, the pathology of stabisacria, right, mainly injury, the physical or mental, whatever, right? That's what do you call it? It's developed tissue damage. It causes tissue damage, mental as well as the physical, right? The hardness and induration. That's why the tumor came. So different tumor, that's the same layer, the same second case she developed. So in such a way, that's where the styes comes. So until, right, to remove the root cause, the patient developed in different manifestation in her or his body. The suppression of sexual desire, especially, you know, everyone knows that stabisacria is a widow remedy as well as honeymoon remedy. We'll come to later. So stabisacria, psychotic, right? The growth of tumor, maybe a cancerous or maybe a non-malignant tumor, then maybe a syphilitic ulcer, right? Hypertension. Stabisacria is one of the best remedy for hypertension. Most of the patient, I treated hypertension very successfully, because most of the people most of the Tamil community people from migrated from Sri Lanka, they had a similar history, suppression, oppression, right? So easily you can, right? They will tell the history, and this happened. Most of them, they were arrested, they were in the jail, and a lot of stories are behind that. So that's why easily you can treat the cases here. And we have a very important part. Very important part over here, the dimension of stabisacria. That's a very interesting things I learned from different masters and also from the patient and different textbooks. What is the dimension of stabisacria? So when you go into deeper in the cases, I find out a lot of things, right? The first phase of stabisacria, after the suppression or oppression or the insult or guilty or whatever, right? What we discussed already. So multiple grief she or her, the patient has. after suppression. But they are very mild. Very carefully you have to listen because it's a little deviation, little difference from the different phase of Staphysagria. So they are very mild, very kind, very soft, very gentle in nature. They doesn't have any bitterness inside. Even though after so many the culprit things happen by others to the patients, so there is no expression. Right? Even though multiple grief, multiple insult they have inside, but they don't take any revenge, but no bitterness inside. That's a very important thing. Even the first case, this was happened, the migraine case. But in case of Ignatia, Pulsatilla, Natimur, they express in different way. So Pulsatilla started crying and all these things and adamant and all, you know the story. Natimur, you know, the mother-in-law and daughter-in-law relationship, what's happened, right? So they sometimes they take revenge in such a way. But Ignatia all suppress and, right, only they don't cry, they suppress everything, but only, right, there are few drops of Dr. George Vidilkas expressed the Ignatia. Only few drops of tears you can see just below the, right? Only few drops. It won't come fully. But Pulsatilla, it comes, oh, it's a, right? It's a crying and weeping. So this is the phase 1 of Staphysagria. What is phase 2? This kind of patients, right? When they come to you, you can observe and you can, right? No need of asking any questions. Even with just talking with them, just have a conversation with them, you will get all ideas. The phase 2 Staphysagria, right? After insult, after humiliation, right? Especially they are affected by injustice. Phase 2 Staphysagria. But there is no violent. That's a non-violent. Non-violent. No expression here. They don't say anything. No fighting. No expression. Right? But only, right? They just they keep inside everything. All right? But in causticum, what is that? In causticum, they do some protest. They do some, so Gandhi has both, some on and off, right? Stabby and causticum and sometimes acid force too. So they do some protest and all these things. Then phase 3 dimension, phase 3, they have the same history, suppression, insult, humiliation. They kept it inside, but the expression may be little different. They throw the things. They do little mild, violent, only mild violent. Don't hurt the others. Shouting is the main phenomena in third phase of Staphysagria. Shouting, verbal abuse, right? But at the same time, the carcinosin, you can compare with the carcinosin also in the same picture, but the carcinosin, what they do. So after all these things, suppression, oppression, and insult, and these things, humiliations, what happened? They destroyed, right? They're breaking the things. They destroyed the thing. So it is a syphilitic manifestation comes. Even though carcinosin is a dry miasmatic remedy, but in their expression is more syphilitic. They destroy. They fight against it. They take a gun and they take the weapon and destroy things. Right. This is a very interesting, right? Then phase 4 also is there. I observed the cases, right? Mainly this case 4, sexually they exploited, sexually excess cases, illegal sexual conduct, illegal affairs. But at the same time, in the family, they are very family oriented. They think that they are family oriented. They have love and compassion with the family and wife and kids. But at the same time, right, this hidden things is happen. But for that, they feel guilty. That is the main thing in phase 4, Staphysagria. What is the meaning of guilty here? They did everything and outside the immoral, all immoral things, and they feel guilty and they pray. Right? They think it's a sin. They confession themselves. They repent. Repentance is a more character of doing thing again and again. Then they go for the confession. Church or just pray. I did these things and all. I pray God and all. So most of the things. It's a very interesting thing, right? We observe it, right? In Staphysagria, right? And okay. So this I explain. And here, the finally, right, the carcinosin is a complementary to Staphysagria. I explained already. So carcinosin is controlled by others, right? But Staphysagria, the insult, this is the carcinosin is controlled. Someone is controlled the person. But here, the cause is insult by others. There's no control in that. So in such a way, you have to, in rubric, so you can you can see in the repertories, right? So mainly the Staphysagria rubrics in red line. These are all red line rubrics. I copied from that repertory. So any questions? So in such a way, with the case or the idea, the experience, what we gather from the patients, then the little go inside and read the Materia Medica and study. Right? Just simply prescribing a remedy, right? It won't help you to improve in the practice. So in such a way, just I want to. Is there any questions?
Now it is the time for the questionnaire. Please, the participants, please raise your hand and ask question to Dr. Manoj.
Yes, somebody should start the.
Yeah, that's a.
Yeah.
Yes, sir. Anyway, nice presentation. As always, you are doing each and every topic with scrupulous observations and always sticking on the basics and principles. That's the most important thing. I think the case of this Staphysagria and colchicum, they are closely running remedies. You can say the Allen's keynote. It says about the very sensitive to what others talking about her. Then an important rubric can see in the Murphy's repertory. It says that it's morbidly sensitive to words of others. Staphysagria. Then I think causticum is also a medicine. Then colocin is also very closely to Staphysagria. So a lot of medicines are there, even though the main, the core symptoms or all features is exclusively present in Staphysagria, I think. That's the most important thing. As you just mentioned about the case of Mahatma.
The another things, that's why I'm searching where somewhere I mentioned. Yeah. Staphysagria is it's a honeymoon remedy, because when we studied, right, our professors explained honeymoon remedy, honeymoon cystitis. So this here, the one thing I forget in which book I got this information. It's a consoling remedy. Staphysagria is a consoling remedy and soothing remedy for a newly married couple. But in that book it's mentioned in both the way, in a both the way means where I which is yeah, I'll tell you. Right. One thing, because of the lot of expectation, right? In newly married woman, she has a lot of expectations with the in sexual idea and the sexual intercourse and all, right? Because previously they doesn't have experience with that. So that's why, so she has more expectation. If the things failure, right? Oh, this much. Oh, I think there are a lot of things inside, right? Oh, this much like that, right? So she felt if anything fails in that expectation, then the staphysagria came into the picture, right? So that also mentioned somewhere. I forget. Right, okay. So that's the honeymoon remedy. Maybe even after injury or honeymoon cystitis, because actual in the beginning they do more, right? The sexual excess practice. So that's also. Any questions?
Sir, what about the potency you applied in all these cases?
Yeah, these two cases, because it's a chronic typical case, right? It's a long running cases. So I started with a 50 millisimal potency, only 0.1 continuously for many weeks. Not it's a single remedy, but in between for one case I used because typical, whenever the patient comes, I think of phosphorus, not staphysagria, because the history is staphysagria. The totality is staphysagria. The actual mental picture is staphysagria. So that's why I stick on the staphysagria. In between, 1 or 2 times I gave
definitely the footnote of aphorism 206 must be kept in mind. These causes are too insignificant to develop or continue year by year. A chronic disease, we should have a consideration. That may be the reason you use phosphorus and it did work wonderfully. That's the reason, maybe. Yes.
Dr. Sridhara Kurup has raised his hand. Now you can ask, sir.
Dr. Joseph, how you can relate with this Homeopathy? Homeopathy is also having some of the feelings.
Yeah.
That unbought.
Yeah. That's a very interesting question, Doctor. The R.Hom, R.Hom always, gold, right? Or always they are in the high position. If anything, they are always right in the top. They always be, they think as the leader. They think as the top priority. They are in high. If anything happen, where is my video? My video is not there.
Yeah, I think it's finished now.
No, not video. Even my video, not the.
We can see you, sir. We can see you.
Okay. I can't see my video. That's okay. Okay. So what happened? Okay. So in Aurum Metallicum, the same thing happened, the insult or anything happened to them, immediate, they won't they won't take as in a such a way. Immediately they committed. You know what they committed? So they think the suicide is most of the leaders, most of the popular persons, right? They did the same thing because they committed suicide. Because they can't tolerate, because if anything, it's certain, even the chilly things happen, they immediately thought of suicide and they did it. So in such a way, they won't have quite a long time. One thing is they want to resolve the problem in such a way, then or otherwise they committed suicide or whatever, right? But the same thing, how they committed suicide. The suicide also, if you take suicidal remedies, right? Different pattern they committed suicides. The Aurum Metallicum, what they do? They just go there in high places, right? They book in the room in the Ooty or somewhere, or in the Himalaya, right? They book the room over there. They committed suicide. They want to go a little even higher, and they jump from there, or they do the hanging, right? Like the hanging themselves. That even though even the suicide also they think in such a way, right? The natal self, you know what they cut their the vein or with the knife. They hurt themselves and they committed. But the antimcrudum, they drawn into they just jump into the well or jump into the water and they committed suicide. And the other remedy, what is the other suicide remedy? Tell me one. Okay.
Even arsenic is having suicide.
Yeah, arsenic, they take it up. You know the poison, right? They take all kind of poison, and it's a simple theory. This thing I learned from Dr. R.S. Pandian. Very well, he was my professor. He nicely expressed all these things in different way while studying Materia Medica.
There was one more medicine is there, starving.
What is that?
Yes. And a few cases, not one, few cases. After that, they will starve, and then they like to be suicide by starving.
Starving. Which one? Maxol?
Maxol.
Oh, right.
One or two cases I covered.
Thank you, doctor.
And this Tachycardia is also suicidal tendency is there.
Yeah.
Disappointment of love and affection.
Yeah. So like that, the other things, and there are, I explained in Tachycardia different phases or different dimension, but some people they may have an all together, or maybe phase 1 or phase 2 together, phase 3 or phase 4 together. So in that's also happened most of the time. But when you go into deeper and deeper, you can you can involve, right, in the medicine as well as the remedy in such a way. So that's why so any questions?
Anyway, thank you very much, Doctor. Very good, nice presentation. Come again for this forum. Okay.
Yes, sir. You can see a lot of disposition, different types of suicidal disposition by the synthetic repertory, and a lot of rubrics are there. With desire to suicide with an axe, that's a medicine. Then despair from another medicine. A lot of subrubrics are there. It's not synthesis, but synthetic repertory, Barthel and Klugger.
Oh, right.
That is not now publishing. So this is the textbook, synthetic repertory, not synthesis, in 3 volumes.
Yeah, synthetic repertory.
Yes, yeah. It's a nice interaction. Those who would like to participate, kindly go to the participant list and please raise your hand. It's a great opportunity because Dr. Paul Joseph is expected to capable of explaining all these things, because his teacher is Pandian sir, is a legend in homeopathy. Is it, sir? Dr. Pandian.
Yeah, see, he is the one of the teacher for us, and the other teachers also I always remember who taught Materia Medica in different way, right? Dr. Subramaniam and Dr. Elango and other the senior homeopaths.
Yes. Sir, what about the difference between this Staphysagrine and Colocynth? How many difference is it?
Colocynth.
Yeah.
Colocynth, and at the same time, I remember acid was. So acid was usually, some teachers, they said Staphysagrine male, but don't fix with that always. But Staphysagrine is female, acid was is male in such a way. Colocynth also. Colocynth in such a way that more, the symptoms which are similar to the Staphylococcus, but the symptoms are more expressed through the intestine, more through the abdominal symptoms, right? I think many of you know that. And mentally, I don't know the comparison. If anyone, any senior homeopaths here?
All
You
are
can see-
senior stuff.
Yes.
Many.
No, senior means to explain in such a way, to express it.
Yes. You can see this case by Dr. Dunham in Dunham's this textbook, where colocin is treated given for case with ovarian tumor and is cured by colocin. Then another example where Hahnemann, this lesser writings, I think there is a ward case. The Hahnemann was suspicious which medicine master gave, and he secretly opened the drawer of the table and examined. He saw that colocin was prescribed for the ward case. Then, but unfortunately, we are giving credit to Kent or other Vidalkas, the method with mental symptoms. Hahnemann also was a master of that. So, sir, second raise hand. Yes, sir, please.
So here, in Pathak, Veterinary America, he mentioned about greatly affected by misfortune, anger, easily vexed, right? And more religious feeling here. Even Staphylococcus, it doesn't have more religious feeling and more religious and certain thing he mentioned. Okay. I think
there the colocin, the extremely irritable anger and indignation.
Indignation, yeah. Indignation, that's the same thing. But
and even from anger, indignation, mortification, vexation, and exposure to cold. These are the main indications of the colocin, mental. Okay.
And here, can I do it again, the screen share? Okay, just a minute. That's the one. The evolution of the evolution of Staphylococcus from childhood. That's why I wanted to tell, right? They're very interesting things. So in childhood, the kids or the children, those who are oppressed, do this and do that and control and in very strict.
Sir, can you, excuse me, sir, can you select that slide so we can also see that? Please. Okay. Okay, sir.
So what happened here in the teaching? I think I had to little. Okay.
It's okay, sir. You can talk now. Okay.
Okay. So here in childhood teasing by peer group people, by friends, and right the comparison with the other kids, right? See, he is doing that one, he is getting more marks and all kind of things. So slowly it's developed, right? In Staphylococcus from young age, right? He being suppressed his emotion instead of expressing what he feels, right? So suppressed emotions are most important ailments from Staphylococcus. So here, see, the Dr. Pathak, he mentioned ill effect of after scolding or punishment in children, right? Most of our Indian community and Sri Lankan community, but here you can't do. In Canada, even you can't scold the kids. They will inform to the school teachers. Next day they will inform. My dad said like that. My mother said like that, right? But here in India, this is the one of the main, right? That's why the more Staphylococcus patients came, right? The other one in adolescent here, the another important picture. See, when the sensitive child enter into adolescent, right, comes romantic And if his feeling are not reciprocate, and there is an extreme disappointment. So the expectation is not in that much. So they feel disappointment, right? Then they started all the masturbation in adulthood and the adolescent the age. It's a common thing, but they're more involved. Staphysagria patient, they're more involved all the time. They get the pleasure. So excess masturbation causes a lot of distress and physical, right, disturbance. And he is cautious. The patient is cautious about what others think about him, right? And so these are the things, right? The M.L. Taylor, he mentioned the least action or word troubles or anyone his feelings. So that's things it's happened. So like that, the evolution is started from the punishment in childhood, right? The comparative with the comparison with other kids. Yeah. So it started slowly and it become right in adulthood. It become a typical.
Dr. Paul Joseph. Now we have to move to the Malayalam. Yeah, it is the time to move to the Malayalam session. It was a wonderful experience. It's a great presentation. Now we got a complete picture of staphysagria. Anyone can treat. So that's very interesting. And I'm inviting Dr. Manoj to give vote of thanks to Dr. Paul and moderate Malayalam session also. Thank you so much.
The WT. Anyway, nice presentation. There is no doubt about that. And moreover, he becomes the ambassador of homeopathy in the Canada. That's the most important thing, most interesting. On behalf of IFPH, I'm expressing sincere thanks to Dr. Paul Joseph and all those participated in the program. Thank you.